what sperm count is actually needed to get pregnancy. When it comes to conceiving, sperm count plays a crucial role in determining fertility. But what exactly is the magic number needed to achieve pregnancy? Let's break it down. Sperm count refers to the total number of sperm present in a single ejaculate. According to the World Health Organization, WHO, a healthy sperm count is typically defined as at least 15 million sperm per milliliter ml of semen, with a total volume of 1.5 millinare to 5 millinare per ejaculation. This means a total sperm count of around 39 million or higher is considered normal. However, pregnancy can still occur even with lower counts, as fertility depends on more than just numbers. The likelihood of conception increases with higher sperm counts, but it's not the only factor. Sperm motility, movement, morphology, shape, and overall semen quality also play significant roles. Even if the sperm count is on the lower side, strong motility and healthy morphology can still result in pregnancy. For example, a man with a lower than average sperm count but excellent motility might still have a good chance of conceiving. That said, a sperm count below 15 million ml is considered low, oligospermia, and may reduce the chances of natural conception. If the count drops below 5 million ml, severe oligospermia, the likelihood of pregnancy decreases significantly. In such cases, assisted reproductive technologies, like intrauterine insemination, IUI, or in vitro fertilization, IVF, may be recommended to improve the odds. It's important to note that sperm count can vary due to factors like age, lifestyle, stress, diet, and overall health. Smoking, excessive alcohol consumption, obesity, and exposure to environmental toxins can negatively impact sperm production. Conversely, maintaining a healthy lifestyle, eating a balanced diet, exercising regularly, and managing stress can help improve sperm count and quality. If you're trying to conceive and are concerned about sperm count, consulting a fertility specialist is the best step. A semen analysis can provide a clear picture of sperm health and guide you toward the right treatment options. Remember, while sperm count is important, it's just one piece of the fertility puzzle. Patience, persistence, and proper medical guidance can help you on your journey to parenthood.